Now, let's talk about pregnancy and the pandemic. Marjorie is here now with advice for moms-to-be, and one of our own moms-to-be, Natalie Preddie, joins us too to share her experiences of being pregnant during this time. And Natalie, I'm going to start with you. How is this pregnancy different from your first two?
I think being alone is really the big difference. The ultrasounds, the tests, everything has been by myself, and this baby screened positive for Down syndrome. So I was transferred to a high-risk clinic where I had NIPT testing, I had genetics testing, I spoke to counselors, and it was a really emotional and scary time, and I had to do it by myself. I had to walk through security, I had to wear a mask, and I was scared, and my husband couldn't be there to hold my hand and share these moments with me and get these results with me, and it's really felt lonely and scary, and I felt really vulnerable. It's been hard.
Natalie, you also say even with the midwife, you see your midwife less, which means you're getting less of a sense of the heartbeat and that support that you would get from a midwife.
Absolutely, that as well. I mean, you know, like I said, especially with this pregnancy being high risk as well, you know, getting those reassuring heartbeats and, you know, feeling, you know, getting the test results or the midwife giving you positive feedback, that sort of thing. It just doesn't happen. I don't see my midwife as often. You know, I'm seeing them this afternoon, and I haven't seen her in over a month.
Dr. Dixon, how can you allay some of those fears for moms-to-be right now?
Well, I think it's a good question to ask. A pandemic is nothing that we ever expected to find ourselves in. And so managing patients for us, even as physicians, as we've gone back to work, I mean, as a reproductive specialist, women's health specialist, we've managed women in pregnancy the whole time, but very differently. And so we are learning how to use tools like the electronics that we have. So we're seeing patients virtually. We're doing consultations that way. We're even doing counseling and support for patients that way. But it's been really difficult because we are also mandated to keep that curve flattened. Fortunately, we do have some technology that helps us to bridge the gap a little bit. We can use your phones, and you can do FaceTime or whatever visual aids that we have to bring partners into the room electronically. So we're adjusting, but I validate that it's not anything that we anticipated, and we're really evolving in our approach the whole time.
Dr. Dixon, we have a question here from Jasmine. So she says, I'm 20 weeks pregnant. Should I be taking any extra precautions?
So what we tell our patients who are pregnant is just to do the same things that everyone else is doing during the pandemic, which is the social distancing, keeping your 2 meters, wash your hands. If you go out in public, you're only going out because you must, to the pharmacy, get somebody else to do your groceries. Wear your mask if you're out. And do the same things that public health is telling us to do. Pregnant ladies, just like everybody else.
Natalie, I know you had a question that you wanted to talk to Dr. Dixon about, so I'm going to let you ask her that now.
Hi, Dr. Dixon. I just wanted to know, you know, what if my baby is born with COVID? I mean, what does quarantine look like then? Does the baby become high risk then? What does that look like?
So we'd have to have the specific guidelines of the public health office where you are locally. But ultimately speaking, there hasn't been in pregnancy any vertical transmission, which means from mom to baby. And the babies wouldn't be born without mom having COVID as well. If that does happen, you get isolated. And then the hospital will teach you, you can even nurse actually, how to manage your baby. But it will be social distancing. You won't have guests. You'll have to wear masks, you'll have to be washing your hands, and somebody will be monitoring the baby closely to see how things progress if the baby does get infected.
Okay, good answer.
Thank
Marjorie,
you.
we have another one from Banu, and she says, I want to have my second child since my first just turned 4. Is it safe to plan now?
So ultimately speaking, there's nothing in the literature or experientially through COVID that is actually telling us that patients can't conceive now. So there hasn't been a mandate to tell people not to conceive. The issue that we're seeing is just that babies that might be born to moms with COVID come a little bit earlier, but they come at term. So it's slightly earlier than term, but nothing that affects or impacts the outcomes. So, you know, if you want to get pregnant, you just will have a very different pregnancy, as Natalie said. It's different, it's isolated, but you can still be pregnant.
Absolutely. Okay, this last one is from Maria. What should I do if I think I was exposed to COVID? This is sort of along the lines of what Natalie asked. I'm worried as I'm 32 weeks. Should I get tested?
Absolutely. So if you believe that you've been exposed and you're pregnant, you find your healthcare provider and they will manage you to get a test. It's the only way for us to know then what to do with it. If you're negative, great. If you're positive, it'll be managed.
Dr. Dixon, thank you so much. I mean, I think you go a long way towards making folks who are pregnant right now feel a bit better. Natalie, I'm so excited for you. Baby number 3, my goodness. She is not only incredibly intelligent, she is brave because she's jumping in for time number 3. You keep having those babies. I think everything's going to be